COVID-19 numbers are on the rise in San Diego County, but hospitalizations remain low.
CBS 8's Brian White spoke with a public health expert to try and make some sense of the upward trend we're seeing in cases.
A rising amount of virus detected in our wastewater, as well as a significant rise in COVID cases over the past 2 weeks, is signaling to doctors that the pandemic is still hanging around.
What we've been seeing nationally and also in Southern California is an increase in cases.
According to the latest update from the county, 837 new cases were reported last Wednesday, and for the week prior, on average, about 400 to 600 new cases were reported each day, with a spike of nearly 1,000 confirmed cases on April 29th. This uptick is a noticeable difference from what we saw just a month ago when those daily numbers were in the 200 to 300 range. So what's causing this?
Hard to say right now. What we're trying to figure out is whether this is another surge of Omicron or something else. I mean, we certainly have plenty of Omicron still circulating.
Dr. Cameron Kaiser is a deputy public health officer with the County of San Diego, and he says they've been tracking the virus in a number of ways, one of which is seeing how much virus is in our wastewater, and they've seen an uptick there as well.
Wastewater surveillance has really given us the ability to get a much more real-time picture of how much viral spread is going on in our neighborhoods.
The most recent data says the increase in cases is widespread and not focused to a certain area.
We're seeing it increasing, generally all over, and we want people to be cognizant of that.
Fortunately, new antiviral drugs like Pfizer's Paxlovid are now widely available. If taken within 5 days of symptoms, the prescription pill can reduce the risk of hospitalization or death by nearly 90%.
We are getting more and more supply, so there is no longer a supply constraint of those oral medications.
With cases in San Diego County on the rise, the future is uncertain.
It's difficult to say exactly where this is going to peak and how quickly it'll do so. Right now, our hospitals are able to handle the load.
Hospitalizations and deaths from COVID-19 remain relatively low at the moment, but our public health officials are constantly monitoring the data that comes in.
I know people are really tired of COVID. There's a whole bunch of pandemic fatigue that's set in, and that's real. But that also doesn't mean that it goes away. Just be careful. And that's, I think, the best takeaway message that people can have.
I'm Brian White for CBS 8.